Do you have sleep apnea? Are you having surgery soon? Here's how your sleep apnea is going to affect your anesthesia. My name's Rick. I'm a nurse anesthetist. When I give you anesthesia drugs, you have an increased risk of upper airway obstruction, which means your tongue or the tissues in the back of your mouth and your neck obstruct your airway and keep you from breathing properly. If you're getting a colonoscopy, for example, where you're breathing on your own under anesthesia, I am more likely to place one of these breathing devices, an oral airway, which keeps your tongue from blocking your airway, or there's also a nasal airway we have. In addition, if you use a CPAP at home, we have devices similar to a CPAP that will give you positive pressure while you breathe on your own, while you're asleep, that we can use. If you're getting a podiatry procedure or a pacemaker, which are normally deep sedation cases, I would opt to maybe use minimal sedation with a lot of local or a nerve block to get you through it and breathing safely. Or for some patients, we would go straight to full-blown general anesthesia to get a secure airway while we do your anesthesia. When we first get to the operating room, we're going to have you breathe oxygen for a while, usually about 3 minutes. And that's to help fill your lungs with oxygen and buy us time to sedate you safely, because you're a higher risk to be difficult for us to breathe for you or difficult for us to place a breathing device once you're asleep. Sometimes it even takes 2 of us to help you breathe as you're going to sleep or waking up. If you're getting general anesthesia with a breathing tube, there's a good chance I'll wait till you are fully awake to take the breathing tube out. That's to make sure you breathe safely. For a patient without sleep apnea, sometimes we can pull the tube when you're a little bit deeper so you don't remember it coming out or anything. There's also a higher chance of you waking up with a BiPAP machine, kind of like a CPAP that you might use at home to help you breathe as you're waking up, versus other patients we would just put some nasal oxygen or an oxygen mask on. So if you have sleep apnea and you're coming to get anesthesia, that is how we're going to keep you safe.